Equine gastrointestinal disorders, colic and more. Topics covered: anatomy and physiology of equine GI tract, pathophysiology of colic, types of colic, spasmodic, impaction, gas, displacement, strangulation, diagnosis and clinical signs, emergency management and referral criteria, nutritional management and prevention strategies, other GIT disorder, diarrhea, gastric ulcer, parasites. Anatomy and physiology of the equine GIT tract, non-ruminant herbivorous with a complex hind gut, small stomach, about 8 to 15 liter limits of food intake, long small intestine, about 20 meter, large colon, fermentation and water absorption. For the purpose of fermentation and water absorption, site of most colic, the large colon, cecum, microbial digestion and has a special structure, rapid transit, require frequent feeding. Pathophysiology of colic refers to abdominal pain, causes gas accumulation, motility disorders, impaction and full loss. Pain arises from distension, ischemia, inflammation. Types of colic: spasmodic, increased gut motility, spasm, mild and moderate, impaction, blockage, pelvic flexure and ileum, gas, distension from fermentation, displacement, parts of the gut move from normal position, strangulation, compromised blood supply, surgical emergency, diagnosis and the clinical signs, bowing, looking at flank, rolling, sweating, inhabitants, rectal exam. For diagnosis, we use these techniques: rectal exam, nasogastric intubation, abdominal ultrasound, blood work. Pain severity not always proportional to lesion severity. Emergency management: analgesia, phanaxin, megliolamine, the best anti-inflammatory in the equine colic. Nasogastric decompression, IV fluid, referral if severe and recurrent pain, HR more than 60 ppm, gastric reflux, abnormal rectal finding. This is the emergency. Nutritional management: consistent high fiber diets, limit grain, avoid sudden diet changes, plenty of water access, deworming and dental care. Other GI disorder: diarrhea, salmonella, clostridium, coronavirus, sand ingestion, gastric ulcer common in performance, horses managed with imperazole. Parasites: Strongylos and tapeworms linked to colics. Equine gastrointestinal disorder, we will dive into one of the most critical and common concern in equine medicine, the colic. Horses have a highly specialized but sensitive gastrointestinal tract. Their small stomach and the expansive hind gut make them efficient fermenter, but also susceptible to GIT disturbance. We begin by exploring the pathophysiology of colic, whether it's spasmodic, impaction, or more severe types like displacement or strangulation. Each has a distinct cause and treatment pathways. We will review the clinical signs that help different mild from emergency cases and walk through diagnostic tools, including rectal examination, ultrasound, and nasogastric intubation. We'll learn key decision points for medical versus surgical intervention and how to manage these horses actually and long term. Finally, we will discuss prevention, because nothing beats avoiding a colic episode in the first place. By the end of the module, we will equipped to recognize, manage, and help prevent GIT disorder in horses and giving them a better chance to pain-free life. Here a case scenario for a horse 10 years old, thoroughbred, gelding, present at 11 ppm, PM with signs of colic, bowing, sweating, and intermittent rolling. The horse has not passed manure in 12 hours. The owner report recent change in richer posture. On exam, HR 34 ppm, CRT 2.5 second, mucous membrane pink, mild distended abdomen, rectal exam, firm mass in pelvic flexure. What types of colic is mostly likely? What are your next step? Should the horse be referred? How could this have been prevented? What is the most common site of impaction in horse? Cecum, ilium, pelvic flexure, or duodenum pelvic flexure. Which is the following signs indicate a need for surgical referral? Mild flank watching, heart rate of 44 ppm, persistent pain despite analgesia, normal rectal exam. What is the primary function of the large colon? Protein digestion, acid production, fermentation and water absorption, nutrient absorption. Fermentation and water absorption. Gastric ulcer are most common in broodmare, performance horse, young foal only, horse on pasture, performance horses. What is the best prevention strategy for colic related to parasite? Feeding dry hay, routine deworming, and feed accounts, feeding grain twice daily, changing pasture every week, routine deworming, and fecal account.